Hello, welcome to Wooridul Spine Hospital TV. Today we are talking with Dr. Sang-ho Lee, a leading expert who is changing the way we treat spinal problems. We will be learning about endoscopic spine surgery. Hello, doctor.
Hello.
We will explore the latest medical techniques for protecting your spine, from non-surgical treatments to minimally invasive spine surgery. Doctor, recently more people are interested in endoscopic spine surgery. Can you tell us what kinds there are and what makes them special?
Sure. The most common condition we treat with endoscopic spine surgery is a herniated disc in the lower back, also called lumbar disc herniation. Next, we treat herniated discs in the mid-back, known as thoracic disc herniation. And of course, there are herniated discs in the neck, called cervical disc herniation. Using an endoscope, neck disc surgery can be completed in just 30 minutes. For mid-back disc surgery, it can take up to 10 hours in the United States, 6 hours in France, and 5 to 6 hours in Germany. Can you guess how fast we can do it here?
I am not sure.
Only 15 minutes. You might wonder how that is possible. With an endoscope, we enter from the side. This allows us to remove only the part of the disc that is causing the problem. We do not need to cut bone or damage joints. We timed the procedure at our hospital from marking the skin to removing the disc fragment and the patient saying, "I feel better." It took exactly 15 minutes. You can even see it on YouTube. Another condition we treat with endoscopy is spinal stenosis. This is usually caused by thickened ligaments or overgrown bone pressing on the nerves, not by a soft disc. Sometimes we need to shave down the bone, especially if the joints have grown too large. Normally, the joint is about the size of a pinky nail, but in some patients, it can grow as large as a thumb. In these cases, we use biportal endoscopy. That means we use 2 entry points, one for the camera and one for the surgical tools. We typically use biportal endoscopy for spinal stenosis and uniportal endoscopy for herniated discs.
I have heard that not many hospitals can perform both types of endoscopic spine surgery. Why is that? Is there a difference in the difficulty and experience required for each type?
Uniportal endoscopy, where we enter from the side, is very difficult. At our hospital, it takes about 6 years to fully train a doctor in this technique. Beginners have a success rate of about 50%. Doctors with some experience reach about 75%, and those with more than 6 years of experience reach a success rate of 99%.
99%? That shows how advanced and unique this technique is at Wooridul Spine Hospital. What is the benefit for patients when a hospital can offer both uniportal and biportal endoscopic surgery?
It is about providing the best option for each patient. Sometimes we enter from the side, sometimes directly from the center using uniportal endoscopy, and in other cases we use biportal endoscopy with 2 entry points. The choice depends entirely on the patient's condition. Seeing a surgeon who is skilled in all these techniques gives patients more treatment options. A well-trained doctor can select the best approach for each individual.
Today we learned a lot from Dr. Sang-ho Lee about endoscopic spine surgery. It is impressive how treatments continue to improve and how each patient can get a personalized approach. If you found this video helpful, please continue caring for your spine and leave any questions in the comments. We will answer them or include them in our next video. Thank you for watching, and we will see you next time.